Okay, so I think everybody's here, at least most people are here. So again, my name is James Kimber. I am a physician assistant, and we're hosting today's webinar with we have Ruth Aguilar, who's a PA in emergency medicine, and co-host is Jordan, who's going to be going to Stony Brook PA school. So I'll just turn it over to Ruth and let you take over from here.
All right, everyone. So my name is Ruth. I am a PA in emergency medicine and urgent care. And so a little bit about me. I'm currently living in San Diego, but I'm originally from Mexicali. Oh, and I forgot to mention, I am a mother of two puppies here. Well, they're not puppies, but my two doggies here. It's Dee Dee and Nugget. And so anyways, they live with me in San Diego, and I'm originally from Mexicali, Mexico, but I was raised in both Mexico and Calexico, their sister border towns in SoCal. And I'm currently working at Sharp Chula Vista, the emergency department, and my Chula Vista doctor's urgent care. And my third one is a per diem job at family health centers. But at the end, I can answer all the questions as to why I have a lot of jobs and I can still manage to have a normal life. So why a PA? The big question that you will definitely be asked when you're interviewing at PA schools. So everyone has a different answer for why you want to be a PA, but for me personally, I come from an underserved community where over 90% of the population is Hispanic. And so the thing that I've noticed the most is language being a barrier. And I personally feel that I am able to establish a good communication with my patients. Just from being from a Hispanic background, I am fluent in Spanish, and I feel like I am able to educate my patients. I come from an area where medical care is not as accessible as other places. And so everyone, and the reason why I'm saying this is because you are going to be asked this question, and everybody, this is a time for you to establish or develop as to why you want to be a PA, and have your own personal story as to why you want to be a PA, and not just answer I want to help someone. You have to have your own personal story. And so a little bit about my journey. I realized I made this a little bit too long, so I'll try to keep it a little bit shorter, and I can answer a couple questions at the end. But I did a little bit of a timeline here, and I try to simplify it, and hopefully you guys can understand it. But pretty much in orange is my education. Green is their internships or my current work. And then on the bottom is travel that I did while I was in undergrad. And so I'm bringing this picture up because this is a picture of candy stripers, and I don't think this exists anymore. And I'm just exaggerating with this picture, but this was me like maybe 10, 12, no, maybe like 14 years ago. And so it wasn't with the skirt, but I was definitely wearing like striped scrubs. And so going back to this timeline, the reason why I'm bringing up this picture is because that was the first time that I was exposed to the medical field. And when I found out what a PA was, I was exposed to doctors and nurses. And this was back in high school. And so now fast forward, I went to San Diego State. I majored in kinesiology and Spanish. And I also wanted to bring up me working at KPVS, which is non-medical field related. And this is just me pointing out that if you're not working the medical field right now, it's not too late for you to either switch or to do something at the same time, because I know everybody has to pay their bills and they can't all afford to be doing many things at the same time. But while I was at San Diego State, I had the opportunity to attend a medical conference for pre-med students, pre-PA students, and I met two people from Stanford. One was a recruiter and another one was a PA, and I actually didn't know that he was a PA, but after they had their meeting to recruit students to the PA program, I stayed behind with another student. And one of the PAs, he was able to, I had the opportunity to volunteer and to shadow him. And if I hadn't stayed behind, I wouldn't have had that opportunity. And so this PA, he in 2011, the one that says medical assistant, after I shadowed him several times, he was able to give me the title of medical assistant after he trained me. It was uncertified, but it still counted as hours. And while I was going through that, the person that I was with at the conference, she told me about the Pathmaker internship. And I know that most of you guys are from all over the place, but in San Diego, that's another volunteer program at Palomar Medical Center, which is pretty much you volunteer as more like a nursing assistant. You're helping patients eat, you're changing them, cleaning beds, taking them from place to place. And that's actually where I met James. It was at Palomar Medical Center. And so this is where like it all snowballed into me finding a job as an emergency department technician when I was at Palomar Medical Center. And so what I'm trying to get with all that I'm saying is that taking opportunities, if you find that there's a conference or there's a volunteer position at your hospital, I definitely recommend that you take those opportunities, because PA schools are definitely looking at volunteer experience and not just paid experience. So this is another volunteer opportunity that I fully took advantage of. I co-founded this organization at San Diego State with another one of my friends. There's actually other ones, I think I don't know if it's only in California, but there's other Flying Samaritans in California. It's a group of students. It's usually pre-med, pre-PA students that organize themselves and recruit doctors, PAs to go down to Mexico and provide free medical services. And so for me, this one was a big one because it's a lot of hours that you put in, that you're able to put into your application, and you get to practice medicine, shadow PAs, shadow doctors. This is another opportunity that I had when I was at San Diego State, and I was able to volunteer in Africa, in Ghana. And this was all from me being an EMT, which I did while I was in college. And this is another one too that I did while I was in the Dominican Republic. And so this is a picture of my class at Stanford. So I got into Stanford in 2015 and graduated in 2017. So I'm going to talk about 3 case studies. And I know I'm like rambling a lot and saying a lot of like the journey for PA school, but I'm going to talk a little bit more about the case studies now, and then any questions that you guys have at the end, you guys can ask me. So I'm going to move on to this one. So I'm choosing 3 case studies that I see all the time in the emergency department and in urgent care. And then we'll go one by one. And then if you guys have questions at the end, we'll go through that. So the first one is cellulitis. This one's a real case that I saw in the ED. So I'm just going to read a little bit of the chief complaint here. So this was a 55-year-old male with history of type 2 diabetes, presents to the emergency department with pain, redness, warmth, and swelling to his right lower extremity. He reports chills, but no fevers. And on exam, he has elevated heart rate, which is 106 beats per minute. Otherwise, his vital signs are stable. On exam, I see that he has redness, swelling, warmth, and tenderness. And I get concerned for cellulitis. I make sure that there's no abscess. Given that there's a history of type 2 diabetes, which means that they're immunocompromised, I decided to do laboratory studies and to make sure that they're not septic. And this involves CBC, CMP, lactic acid, and blood cultures. So what is cellulitis? Cellulitis is a bacterial skin soft tissue infection. And this just means that bacteria is going through the skin barrier. And it usually presents, just like I mentioned before, with redness, tenderness, swelling, warmth to the skin. It's usually one-sided, and it most commonly affects the lower extremities. People may have fevers or other systemic symptoms like elevated heart rate, low blood pressure. And the two most common pathogens are streptococci or staph, which affects what medications you will give. Sometimes you can culture the wound, especially like if it's an abscess, to see what type of bacteria you actually have. And so I don't always order laboratory testing for people with cellulitis, but if they have comorbidities or if they have like type 2 diabetes, autoimmune diseases, I usually do. Or if any complications, like if you're suspecting that they have a bone infection like osteomyelitis, you may want to get laboratory testing. And so for this guy, the labs were all normal, so I felt comfortable sending the patient home with antibiotics, and I commonly prescribe Keflex and Bactrim DS, which will cover for strep, staph, MRSA. I usually recommend the patient to use warm compressions, to elevate, and then recheck the wound or the cellulitis by their primary care doctor or back into the emergency department in 2 to 3 days. And so I mentioned earlier, I made sure that there was no abscess. So what's the difference between cellulitis and abscess? They can sometimes be seen together, sometimes separate, but an abscess is a collection of pus or purulent discharge within the dermis, so underneath the skin, which usually presents as a painful red nodule. If it's fluctuant or if it looks like it's drainable, the treatment is to perform an incision and drainage, meaning that you get a scalpel, you make an incision, and you try to get the purulent discharge out. And you want to start antibiotics. Most of the times I do, and it's similar to cellulitis, so I would do Keflex and Bactrim. And sometimes this is where you can culture. I was thinking of adding a slide where there's actually incising, but I don't know if like anyone's going to have a vagal or pass out in this presentation. So if you're interested in seeing one, you can definitely YouTube incision and drainage of an abscess, and you'll definitely find one. So my second case study is for lacerations. So all lacerations, they can either be nothing to, you don't have to do anything. You can just monitor. You can close with sutures. You can close with steri strips, dermabond. But this one specifically, I'm gonna present with sutures. So this guy is also another case that I had in the emergency department. He's 25 years old, no past medical history. He sustained a laceration to his left earlobe after a ceramic pot fell into his head while he was wrestling with his brother. The injury happened 1 hour prior to arrival. He did not lose consciousness. He does not have any neck or back pain. So the first thing that I want to do with this guy, because he had head trauma, is to make sure that he has a normal neurological exam, which he did. The wound was only localized to his ear, so there was no injury anywhere else. Because it's close, because it's his ear, you want to look inside the ear, make sure that there's nothing in there. And then for this guy, it was minimally contaminated, so I'm not necessarily super concerned for infection. So indication for sutures, if the wound extends through the dermis and it's likely to cause a big scar, you want to make sure that you do approximate the edges. And for this one, I specifically did suturing. You want to avoid doing sutures if it was like an animal bite or human bite. And believe me, people do bite each other. So there's definitely people I've seen with human bites. But for this one specifically, he does meet the criteria. He came in only a couple hours after the injury. You also want to avoid suturing if it's superficial. So if it doesn't look like it needs sutures, don't do it just to do it. If it's super contaminated, you also want to make sure, or if it's infected, you don't want to be doing a wound closure. And so again, you can use also staples, steri-strips, Dermabond for wound closures, but for this one, suturing is what was more indicated. So for him, because where he has the wound, you can actually do a nerve block to not swell up the ear with lidocaine, with the numbing medication. If you put numbing medication directly onto injury like that, or if it was like the lip, it may look a little bit weird after you're done, after the swelling from the lidocaine goes down. So for this guy, I did do a nerve block. I also irrigated his wound, and you have different selections of suturing material, whether it's absorbable, non-absorbable. There's different sizes, but you'll definitely learn all of this once you're in PA school. And so for this guy, I sutured his ear, and I just gave him instructions to come back in 5 days, either to the emergency department or another urgent care to have him removed. And any signs of infection, he needs to come back. Okay, and then my last case study is a distal radius fracture. We see this one a lot, and this is mainly from people falling with an outstretched hand, which we call foosh in the emergency department. And so this guy, he's 45 years old, no past medical history. He was playing soccer when he fell with the outstretched hand, no head trauma, no other injuries. And so this is not a real picture. This is just a picture that I got from the internet, but most injuries do look like this, where you have a deformity. And so in his exam, it looked just like this. He had a deformity. It was tender. He didn't have any other injuries. So I just got x-rays of his wrist, and I ordered pain medication. And so for this x-ray, it shows the distal radial fracture. Because he does have the deformity and there is a lot of pain, you want to reduce the fracture, which means that you want to put the bone back into its place to relieve swelling, pain, and nerve compression. So for this guy, I actually did what is called a hematoma block. So you put numbing medication to where there's bleeding from the broken bone. And I also do either like morphine or Dilaudid or an opioid that you can give while you're in the emergency department. And once you have the area numbed and they have either morphine, Dilaudid, you can put him on what's called the finger truss, which is here on the right side. And that's just gonna allow the bones to go back into place on their own. Sometimes you can use just that and it goes back into place on its own, or you can manually manipulate the bone, which is what we typically do in the emergency department. And so for him, we applied a splint right after we repeat the x-ray just to make sure that it's in place, and then we have them follow up with an orthopedic specialist. And so for my last slide is just talking a little bit about what I actually see in the emergency department, which is very similar to what I see in urgent care as well. It just depends on what type of hospital you're working at. I've worked in San Francisco too, where anything that comes in the door, you split it with the physician that's there. In the ER that I'm working at right now, you're seeing a little bit more of lower acuity cases, and the MDs are usually the ones seeing the higher acuity. So like the CPRs, the chest pains, they're the ones seeing the life-threatening conditions. And so me in the emergency department, I usually see about 25 to 30 patients a shift, and I work about 10 hours per shift. And I would say that the most common conditions that I see are what we just talked about. COVID, any COVID symptoms, anyone with fevers, we're the ones who see them. Asthma exacerbations, UTIs, allergic reactions. And so if I ever do have a question while I'm in the ED, That's why you have your attendings, the doctors, your supervising physician. So you're not necessarily working next to them, but if you have a question, they're always there to support you. But I would say that sometimes I don't even see them throughout my entire shift. And sometimes I do ask them for advice and say I'm not too sure what to give a patient for, say they have appendicitis and I'm too sure what antibiotic to give them because a specific surgeon likes certain medications. I go up and ask them or anything like that. But I would say that where I'm currently working at, the culture is very like pro PA, and we see each other as colleagues, not necessarily like they're my boss. And so from all the ERs that I worked at, this one has been where I've been the most comfortable. And so I think that would be the end of my presentation. But in all, I love my job. I love working with other PAs and the doctors currently where I'm at right now.
I have a question. What's like the craziest thing you've seen in the emergency department?
The craziest things were always in San Francisco. It's very calm here in San Diego. I did have a patient in the Tenderloin. We do have a lot of people who have problems with drugs, and so we did have a patient who was under the influence. He was using meth, and for some reason he decided to use a shampoo bottle to use his penis in a shampoo bottle. And so it got so swollen that we couldn't get it out. And so he had to get it surgically removed. But it's very common, for some reason, it's very common to see things like that. We've seen a lot of people, a lot of overdoses are very common in San Francisco. But that's like the only crazy thing that I can think of on top of my head right now.
Thank you. We do have a few questions that came in. The first one is, as an EDPA, do you have more than one supervising physician?
In the ED, yes. So usually, well, in San Francisco, I would only work with just one supervising physician at a time. It just depends on the size of the hospital. So for example, at Palomar, where James used to work at, in that ED, they had several EDP MDs at the same time. So you'll have more than one. And sometimes there's an area where you work with one MD, but there's other areas, but you should only really be with that one other MD. Here at Sharp, where my current ED, there's usually like 3 or 4 MDs, and I can like ask questions to anyone, and they're all my supervising physicians.
Got it. Thank you. The next one is, how do you manage all 3 jobs?
Okay, so for that, so there's one full-time, and my full-time is 3 shifts a week, and they're 10 hours. So that's only 30 hours a week. And so for me, that I like to think that I'm still young and I don't have any kids. I do think that I have a lot of extra time in my hands. And so I do have 2 per diem jobs. At least one of them, I have to fulfill 4 shifts a month, and that's 10-hour shifts. So that's technically only 40 hours a week. And then just any extra shifts that I want to pick up later for my 3rd job, they're very flexible. So if I don't want to work for 2 months, they're completely okay with me not working. And then when I have a lot of extra time, I just pick up. But I definitely do have the 40 hours a week. And so it's my full-time and per diem. And once you become a PA, you'll notice, especially like if you work in emergency medicine, it's very, very common for people to have 2 or 3 jobs. It's very normal in the ER.
The next one is, how is your autonomy as an ER PA?
So also depends on the hospital. So like I said, in San Francisco, anything that came in, I could see as long as I felt comfortable. And so I feel like and I haven't really had any issues with any doctors not allowing me to do something unless I don't feel comfortable. So it just more depends on where you work. But I think nowadays you're pretty much allowed to do anything that you feel comfortable with.
The next one, you got a bunch coming in.
I
Do you
know.
ever have to consult other specialties while in the emergency department? For example, consult ortho before a reduction?
Not always. So for example, this guy that I just talked about, I didn't consult anyone because I already know what to do. I see this often. But if there's something that's very how do I say in like layman's terms, so you guys can understand. So if it's very like out of place where I know that I can't get into place and it's unstable, or they have they're neurovascularly like not intact, or there's any issues with their nerves, I might consult the orthopedic specialist. Sometimes I do ask one of my supervising physicians first, but if I already know what the supervising physician is going to say, and if they're going to say, oh, we'll consult ortho directly, then I can contact them on my own. At Sharp, I don't have any restrictions as to who I can talk to. I can pretty much talk to any specialist. I did work at another emergency department in the Bay Area in San Jose, where I could only speak with certain specialties. So like, for example, OBGYN, we couldn't talk to them. It had to be our supervising physician. So again, it just depends on the hospitals, but I would say for the most part, you can talk to anyone.
What study habit did you find the most helpful?
Does it say if like in PA school or college?
Doesn't say any specifics, but I guess
It was
anything.
very different. It was very different. So I would say for, I don't know, PA school was, I pulled a lot of all-nighters for sure. It's just PA school is very intense. It's just different because you're not really allowed to work while you're in PA school. So your focus is like 1,000% onto PA school. And so I feel like all I did was study and all I did was be at the library. And so I think it's mainly like organizing yourself. I definitely didn't, well, I don't have any children, but a lot of people in my class had children or were married. And so I think it's just more organizing your time. So you have time to study, and not just study, but also be with your family. But I would say to just like mainly stay healthy and study when you can. Don't waste time either. I definitely wasn't going out or doing anything like that during PA school. It was just pretty much focused into the program.
I can't wait. The next one is, when you first started being an EMT/PA, have you ever been scared of working with blood or extreme injuries, or have you never really been affected by it?
I'm only affected when they poke me. When I poke someone, like I love it. I love opening abscesses. I love lacerations. I think maybe actually in PA school, the first time I removed a toenail, I did pass out. But after that, every time that I see a toenail that I need to remove, I try to prepare myself. And I think if you already prepare, if you have a fear of like needles or blood, it's just more of preparing yourself before you see it. But otherwise, no, for me, I think it's been fine.
Next one, why did you use a warm compression on the patient that had cellulitis? Doesn't inflammation get worse with warmth? Thank you so much.
For cellulitis is a little bit different. So when you have a fracture or like a new injury, yeah, icing is what we recommend that you do. But for cellulitis, with warmth, you bring blood flow to the area, so it allows the injury or the cellulitis to heal faster. So for cellulitis abscesses, it would always be warm compressions to bring blood flow to the area to heal faster.
What is one piece of advice that you would give to your younger pre-PA self?
I don't know. I want to say like not to do so many things because I was crazy in college and I was doing a lot of things, but it got me where I'm at right now, and so I don't regret anything. I think maybe more sleep. I don't think I slept that well well, actually maybe not right now either, but definitely in college, I would say just try to stay healthy and take care of yourself.
The next person said, my family is from Mexicali and collects goat too. What is one of the most difficult things about being a PA?
for me, it has been language. I have struggled all my life with my accent. So sometimes trying to communicate, articulate myself has been a little bit difficult. Which maybe is not like necessarily answering that question, but I think personally for me, it has been still language, because I think in Spanish and then I have to like translate it to myself. But in general, the most difficult thing as a PA, I think, not difficult, but understanding that you're always going to be learning something. I have never felt like, oh, I'm done learning. I feel like I'm still always learning something new.
What made you choose to work in the ED?
I think my personality, because I'm a little bit intense. I'm more of like, I'm more of I get bored easily. So I'm always doing something. And I feel like the emergency department keeps me entertained, and time goes by so much faster while you're learning so much. And so I think definitely if you're not too sure what field you want to go to, if you're more of like a fast-paced person and you have the patience for it, I think it might be good for you. But I wasn't 100% sure if I was going to do the ED until I actually did my rotations, which you will have the opportunity to experience once you're in PA school, because you have to do several rotations and then decide, and then you'll probably have an elective to kind of decide whether that's what you want to do or not.
Next is financially, how were you able to afford PA school at Stanford? That is my concern with being in debt attending a school in California.
I'm still very in debt, but I would say that the debt doesn't, I mean, it matters, but it doesn't matter. You're gonna get into PA school, you're gonna make a good amount of money, and you're gonna be able to pay it back eventually. For me, it was a little bit different because the Stanford program back then was charging community college tuition. And so my tuition was actually not that bad. I think maybe it was I'm like $40,000 in debt compared to like other people who are probably in the 200s and 200Ks for PA school. So I think that question for Stanford specifically is a little bit different, because now their program is a lot more expensive.
This is similar to a question I was asked, but in case they missed it or just asked before the other one was, but how much autonomy are you allowed?
Anything that you're comfortable with. So if I learn something new that I wasn't comfortable with doing before, I can start doing it now. So it depends on the hospital, but I would say that most places allow you to do as much as you want to.
How do you suggest getting shadowing experience if some places are hesitant to have you because of certain COVID restrictions?
Maybe not so much anymore. We've been, at least in the urgent care that I'm at, we've been getting a lot more students, and we didn't really, like in 2020 when the pandemic was starting. So I would say to still try to ask anyone really. I mean, I would say that a lot of places allow shadowing. You just need to ask, and that's what I meant like before, like in my presentation about like opportunities. Like if you just ask like multiple people, or you go on LinkedIn and start asking people, then that's something that you might be able to do. But for me, I was just lucky enough to have met so many people throughout my experience as a volunteer. So even like trying to volunteer and then meeting providers, that's how you can just ask, oh, hey, can I shadow you? Even if it's not necessarily like official where you need to like sign anything to shadow them, you can just ask them. And I would say that many PAs are going to say that they're fine with that.
Is there usually just one PA per shift, or do you work with more PAs?
So this is going to be like a multiple answer. So right now where I'm at, it's only one PA, like one PA in the day and then a different PA at night. So you don't really, you only interact when you say hi and bye, and that's pretty much it. And this is in my ER at Sharp. When I was in San Jose in the Bay Area, it would be maybe 2, 3 at the same time. So you would work with other PAs, which was awesome. And I'm also at the urgent care that I'm at right now. It's usually 3 at the same time. So I get to be with them and it's a lot of fun. So it just depends on the place.
How did you know which specialty you wanted to go into?
Well, other than my personality before that, when I was an EMT and I was working as an ER technician, I was very exposed to what the PAs in the emergency department did. So I kind of already knew that I wanted to do ER since the very beginning. So I think just getting exposed before PA school gave me a clear answer as to what I wanted to do.
This is kind of like similar and like a follow-up. Did you always want to be an EDPA, or were there any other specialties you considered?
Before PA school, no. Before PA school, it was always like, oh, I'm gonna be a PA in the ED. But I did once you start doing rotations, you're like, oh my God, this is like really cool. Maybe I could do this if I can't get into like a job, if I can't get a job in the ER. So for one, I did consider derm because of the procedures that they would do. For me, I also love procedures, which is why I'm in the emergency department too. But dermatology gets to do that a lot. So that was another thing that I was thinking about. And then my third option was surgery, because of the procedures. So once you get into like the rotations, you may be going into PA school at the beginning thinking, I'm going to do this. And then you might change your mind too after the rotations.
As an EDPA, how long was it right out of school that someone would be on their own, like treating your own patients? Did you feel as though school prepared you well?
The first day of my job, I was just pushed in. So I started right away. I think they wanted me to present cases for like maybe the first 2 months. So I would see the patient on my own. I would present the case to my supervising physician in the ER, and they would either be like, okay, sounds like it's the right plan, or they'll be like, I wouldn't do that. Let me go see the patient. And that's how you learn. And then once they start trusting you, they start seeing that you're listening to their feedback and that you're actually applying what you learned in school to the real practice. They'll let you be completely on your own. So for me, it was maybe about 2 months. For some people, it's faster. Some people, it's a lot slower. And so just depends on the place that you initially start, because there's also fellowships. I think Arrowhead has like a ER fellowship. It's kind of having like a residency after PA school. And so it's a lot more of training, and then you'll be on your own, but you're very ready once you're done with that fellowship. But for me, I kind of more learned on the spot with the help of my supervising physicians.
Do you have any information about traveling as a PA?
Kind of. I mean, at least for Flying Samaritans, if you even not as a PA, like anything, like even if you don't have EMT certification, even if you just want to volunteer, Flying Samaritans is an organization where they accept anyone to join, and they're always looking for providers. And so they do contact me once a month to see if I want to join them. So for me, that one's easy, but it's also super local, and that's in Tijuana, Mexico. So that one's like super easy for me. I live so close to the border, actually, so that I usually just drive there myself. But for out of Mexico, not necessarily, but I would say like the organizations that I had in the PowerPoint at the beginning, like global brigades, they also look for providers. And I think it's just more of like you going online and applying for it. And usually they always looking for providers. So I don't think it's something that's hard to do. I think it's actually like super easy to be able to volunteer abroad anywhere.
How did you make yourself competitive to get into Stanford's PA school?
I would say more of the hands-on hours. I think I at least fulfilled the minimum requirement of hands-on experience hours. And I think that was 3,000 at the time. And I think I had like 7,000 or something like that. I had a lot of like paid hours, but that's because I did EMT school while I was in college. And then I was able to work right away. And so I try to work while I was in college too. So I built up a lot of hours, and then I also had a lot of volunteer hours. And I think for Stanford, I don't know if now, but at the time, it wasn't just about having like a 4.0. It was being a well-rounded student and having your volunteer hours, hands-on experience, and then the grades, the prerequisites.
What solidified your decision to become a PA versus an MD?
At least for that one, I made the decision, I think in maybe when I was a freshman in college. And it was mainly after talking to a lot of PAs and MDs. And actually a lot of MDs told me if I were to do it all over again, I would choose to be a PA. And I think now that I'm working, I like not being the supervising physician and actually having someone that I can ask, hey, what would you do if in this case, or they do have a little bit more of like the responsibilities of seeing the higher acuity patients. And I don't necessarily feel 100% comfortable seeing those type of patients. That's why I like working where I'm at right now. I see lower acuity, I see them a lot faster. And the other reason was a lot of my friends who started college with me, they're still doing residency, and I am already almost about to be 6 years practicing as a PA. And so there's one friend that she's, I think, her first year in pediatric residency. The other one is like a third year ER. And so they're just still finishing their residency. And I've already been practicing on my own for so long. And so I think that's another one. And then the tuition, I mean, it's a lot more, but that, I think those are like the three main reasons. And if I can do like the procedures, the things that I like doing, and I can do it a lot faster, then why not?
Yeah, what tips do you have for for Spanglish PA students and how to better manage language barriers for those practicing on the border?
I mean, I don't necessarily see it like a struggle. I think or not necessarily that I don't have advice, but I definitely connect with patients so much better than my coworkers who don't speak Spanish at all. And so, I mean, the only advice I can have is to just keep practicing your Spanish and become very fluent at it. And then also with your English. And so if you're able to communicate with your patient in Spanish, exactly like what you want to say in English, that's how you can have the patient get better, stay healthier, follow up, and they can understand everything that you're saying. So I would just say to keep up to date with your Spanish medical language.
How about study habits / tips in college and what to do to optimize your time in college to prepare for PA school?
No, it was a little bit different than PA school, because PA school was like so just like PA school and nothing else. In college, I feel like you do have to worry about like the volunteer stuff, you working, and then your social life. So I would just say having a balance between all of those, because you don't want to just study 100%, not have a social life, and then forget about volunteering or working. And so I would say that obviously try to have a great GPA, because if you have a very low GPA, you're not going to get into any like PA school. But if you're struggling with studying, there are a lot of programs, especially like for those who so I was in this program for like not underserved, but for like low income, and they offered like free tutoring. So if you're one of those students and you're struggling with like statistics or calculus, chemistry, they do offer a lot of those programs. And even if you're not low income, they do offer programs like that, but they have some charge. And so that's something that I would look into if you're struggling with like studying habits.
Where did you find your volunteer EMT opportunities?
When I was doing Flying Samaritans, I was able to get a lot of like nursing students into the organization, and they had this yearly international medical trip, and which is called the Global Brigades, which is at the time was only for nursing students. But I had a connection with the nursing professor who allowed me to get into their international trip. And so it was just more of like, because we had a relationship. I'm not too sure if it's open now to just nursing students or pre-med students, but I would definitely look into it. It's called Global Brigades. And that's where I went to Ghana, Africa. And I went to Thailand. And then the other one that's a really cool experience was Trek Medics, but that's not Global Brigades. That one's specifically for like EMTs, and I helped them set up a 911 system in a rural place in the Dominican Republic. And now that 911 system is getting used in Tanzania. I forget what, maybe Puerto Rico too. But they have different cities all around the world where they're using that 911 system, and EMTs are training their locals to become EMTs because they don't have the resources to have EMTs. And so that's pretty much what I did in the Dominican Republic, and I did it for like maybe 3 months. So that's another opportunity to consider.
Which department do you recommend to start off with as a PA?
I would say that's totally like personal, because once you go through the rotations, your rotations in PA school, you'll have a better idea. But if you're like, okay, I have no idea whatsoever where to start, maybe family practice or urgent care would be somewhere to start, because you'll get exposed to many different conditions, or you'll maybe have a better idea like, oh, well, maybe family practice is like too slow for me. Maybe I want to specialize in something like OBGYN or ortho, and also urgent care gives you a little bit of everything.
How often do PAs switch specialties as opposed to staying in one specialty and gaining experience and credibility?
I think PAs do switch quite a bit. I have been in between urgent care and emergency department, but that's also very common with ED people to do urgent care at the same time. But a lot of my colleagues have switched from like oncology to now doing dermatology. One of my urgent care coworkers, she actually did neurosurgery for like 4 years, and now she's in urgent care. So I would say everybody always is switching. I don't think I've met someone that has just stuck to something. It's few, but I would say that in the PA field, that's another reason why you want to do PA school and not MD school, because once you're stuck to a specialty, you'd have to go back to residency. And so with PAs, being a PA, you can switch as many times to any specialty that you want. And I don't necessarily think it's like credibility, but say if from the ER I wanted to go to like surgery, it's not that they're not gonna they're gonna think like I'm a new grad. I'm not, because I've been learning all these years, but they're going to have to be willing to teach me the things that I don't know from surgery. So it just depends, but I would say that it's very easy to switch without a problem.
I'm not sure if this was answered, but can you please talk about your average day/week in terms of scheduling, work-life balance, etc.?
I work every Monday, Tuesday, and Friday, and I work 10 hours. So it's like 8:30 to 6:30. And then this made me too personal, but I usually go rock climbing after.
Wow.
And then on Wednesdays and Thursdays, I'm off. And so I'm also off Saturday and Sunday. So that's like 4 days. And I usually try to do an ER shift in between any of those 4 days. And in between that, I usually go to yoga or still rock climbing, and then just spend it at my house with my dogs, my family. But yeah, I'm a very active person, so I'm always doing like something that has to do with rock climbing or yoga or running. And so I have time for all of that. And then even then, that's only 4 shifts. I have 3 days off. So I still have a lot of time in my hands.
Do you think having a specialty in mind before rotations is a good idea?
For me, I kind of already knew, but I was being open-minded to any other specialty. But I would say that a lot of PA students, they actually don't know where they want to go. And so, but that's the whole point of like the rotations, for you to see where you feel comfortable at, what's calling for you. But I would say that if you're already an EMT or you were exposed to the ER, you're most likely going to lean into like, you're going to end up in the ER. But if you've never been in that field, I think it's like fair game. You're not going to know until later.
Okay, Jordan, just so let's pick one more because we're about at that time. I know there's a lot, but in all fairness to Ruth, I don't want to. So, this is your last question.
Can I just do whichever one's next?
No, I'm going to leave it to you, Jordan.
Oh gosh, this is so much pressure. Let's see. I'm quickly scanning through to see what would be. This one's good. What should we focus on when applying or looking for PA schools? Like certain requirements some schools have while others don't.
Okay, let me share my screen real quick because I didn't show you guys this. Okay, so when I was in PA school, I did this. I don't know if everybody does this, but I try to input all the PA schools and I narrow it down to like the schools that I could possibly get into by either GPA, whether they needed the GRE, also like tuition, whether it was out of state. What else? I think I also did like how long their program was and which prereqs they wanted, because some want like, for example, like OChem, and I didn't take OChem. So I was like, I'm going to eliminate all the OChem. I'm not saying to do this because this seems a little bit crazy now, but maybe like
No, I did it.
like
It's not that crazy.
say like if you just want to do like one state or like you want to stick to like California, then do an Excel sheet like this and kind of try to narrow it down which ones you can actually apply for. Because if you don't do this ahead of time and you apply and then you're like, oh, they actually wanted this, and then you can't apply. So I would do something similar to this, but like a lot smaller.
I'm sorry we weren't able to get to all the questions, but I want to thank everybody who did attend. And of course, Ruth, thanks very much for your time. I mean, it's been a long time since you and I have spoken, but I appreciate you helping out tonight. And Jordan, of course, as always, thanks for your help in fielding the questions.
Of course. I love the presentation. I've learned so much.
Thanks, Jordan. Appreciate all of your help as always. And Ruth, thank you so much. It was a great presentation. I even learned some stuff, but I'm sticking with neurosurgery. No ER for me.
No, thank you, James. And one thing I didn't mention was that you helped me through this process before you had this program. And so it's just amazing to see that you have this program now because you helped me when I was going through like the whole PA process. And so no, thank you for inviting me to talk today.
Sure, thank you. Okay,
Nice
everybody.
We'll
post I'm not sure when the next virtual session will be. It'll probably be in about a couple weeks after the holidays, but just check our Instagram or Facebook and we'll have it posted up there. But thanks everybody for attending.
Thank you. Happy Thanksgiving.